Welcome to the future of healthcare, where technology bridges the gap between patients and providers, ensuring continuous care and monitoring. Today, we're exploring how combining remote patient monitoring, or RPM, and chronic care management, or CCM, is revolutionizing patient care. Hi, this is JP from ThoroughCare. Here at ThoroughCare, our platform helps practices manage, bill, and streamline reimbursements for value-based care programs like chronic care management and remote patient monitoring. With 2 in 3 Medicare patients suffering from 2 or more chronic conditions, the need for chronic care management has never been greater. It's important to keep in mind, however, that CCM is just one piece of the care management puzzle. Over the years, Medicare has created other care management programs to provide a holistic patient experience and implement preventative measures. One of these programs is remote patient monitoring. When combined, CCM and RPM can greatly improve patient outcomes while providing additional opportunities for reimbursement. Let's look at each program's role in managing chronic conditions. Chronic care management helps patients with 2 or more long-term conditions better manage their health. A successful CCM program offers comprehensive care, goal planning, and ongoing patient support and education. Remote patient monitoring uses digital technology to track patient data outside traditional healthcare settings. Separately, they're effective. Together, they're transformative. So how can RPM enhance CCM? With CCM, providers offer services to patients who suffer from a variety of medical conditions, such as diabetes or hypertension. By using digital devices provided through an RPM program, such as a glucose meter or blood pressure cuff, patients can transmit health data directly to their providers. This data can trigger interventions to avoid exacerbation, provide additional engagement touchpoints for care team members, and holistically improve the patient's care. Aside from increased patient health benefits, the CCM-RPM combo brings added revenue to providers with more billable services. RPM is reimbursed through time-based CPT codes, as well as device-based codes. Providers are compensated for the initial setup of the devices and monthly monitoring, as long as 16 days of readings are recorded. For example, if you have 100 patients enrolled in CCM and spend 20 minutes per month on each patient, that national average reimbursement is around $6,150. However, if these same 100 patients are also enrolled in RPM with 16 days of readings a month and an additional 20 minutes of RPM services, you could earn an extra $9,460 in monthly reimbursements. You may think that reaching 20 minutes for both programs will be challenging. If done correctly, however, it's not that difficult. Both CCM and RPM accrue non-face-to-face time, including everything your care team does for the patient's health. Completing daily tasks like charting, reviews, medication refills, and monthly outreaches can easily reach 40 minutes in total. Keep in mind that the time-based and device-based codes for RPM can be billed independently and are not reliant on one another. So you can bill for the 16 days of readings without accumulating additional RPM time. This alone can add significant additional reimbursement while gathering valuable patient data. Enrolling patients in CCM and RPM not only increase savings and reimbursements, it enables providers to expand their business. Revenue can be used to support additional clinical roles, allowing for more time spent with patients. By addressing patient needs more frequently, outcomes are improved and risks are reduced. You might consider offering additional services to your roster, such as behavioral health integration, further diversifying your revenue stream. Leveraging RPM alongside CCM can also help to achieve value-based care objectives. These include improving patient engagement and satisfaction, enabling better patient health, and maximizing clinical efficiency. As you can see, remote patient monitoring is an ideal program to complement chronic care management. And the best part is, if your staff is currently managing a CCM program, the foundation to offer RPM services is already in place. If you're interested in integrating RPM with the CCM program, you can find more information on our website. To learn more about how ThoroughCare can help set up and manage preventative health programs, please reach out using the link below. Please click like and subscribe. Thanks for watching.